much.
All right, good morning. This is Senate Health and Welfare. It is April 12th, and we're focusing today on two topics. One is our budget priorities, and we've included in that some testimony from our Chief Prevention Officer, Monica Hutt. She'll be coming in a little bit. And then we'll focus on H265, which is the Child and Family, Youth and Family Advocate Bill. So Jen Carby is here, and Nolan is here. Good. And we have a preliminary
Yes, it
document.
should say, we should have put draft or something on it, but it is just a draft.
Okay, it's just a draft. So we've got it. So why don't you, so this just reminder, this committee went through, has been through a number of bills that contain appropriations. And then we also have received requests for appropriations in our world of health and welfare. And we went through that together, and then Senator Hardy and I met separately with Jenna and Katie, our ledge councils, and then Senator Hardy and I met for a short time, and then I met again with our ledge councils yesterday for another, I don't know how long that was. Okay, so this is a product of multiple working. Thank you, Jen.
Yes.
And Nolan, I just want to say that having the spreadsheet, it has been fabulous for us. I know I asked for it, but the way you did it is just really very helpful and really appreciate it. And this is the latest draft. This is the latest draft of Nolan's spreadsheet that contains, it doesn't have the bills on it, right?
No, the bills are a separate one. That hasn't changed.
Okay.
Old version.
It's cool. Okay, thank you.
Sorry. Really two different documents.
Is there one I can have?
Yeah.
Great. Yes, thank you.
I added three more things.
Okay.
All right.
All right, then.
So for the record, Jennifer Carby, Office of Legislative Counsel. So the document that we are looking at is a draft memo. I've been trying a different approach to memo format for appropriation memos this year, and I know in the House they have really enjoyed it. Rather than just having all narrative, it's a lot of kind of chart presentation table, so that it's easy to see what the proposal is, what the amount is, and anything the committee wants to say on it. So Katie and I have been working on this together. It starts out with some language from you appreciating the opportunity to share your recommendations on the FY23 budget with the Senate Appropriations Committee, and acknowledging the significant difficulties associated with making financial decisions in the midst of an ongoing pandemic. Then it talks about the committee seeing some natural linkages within some of the budget recommendations and requests that the Senate committee think creatively about how to fund the initiatives. And it gives some examples, like whether housing funding could be used to fund the housing pilots for individuals with developmental disabilities as proposed in H720, or to fund the peer-operated respite centers as proposed by the committee, this committee's report for S195. Similarly, looking at whether there are opportunities to leverage funding received through the opioid settlement in H711 for opioid overdose prevention pilot programs in H728. And then it says, as the Senate committees on appropriations and on finance work together on finalizing state revenues and spending, it is important to this committee that reach-up families be held harmless in order to realize the full benefit of any child care tax credits they may receive. And also has this committee recommending considering the use of tobacco settlement funds for tobacco prevention activities. Then we get into the table format. So looking first at bills passed by this committee and some appropriations there. So there's the Parent Child Center Network, And this committee's report appropriated $8.55 million, which is $5.2 million above the governor's recommendation to DCF. I don't have anything else to say on that, so we can have the notes. For S195, the mental health peer support specialist certification and expansion of peer respite centers, because that's what gets added in the notes. This committee's report appropriated $525,000 in FY23 to DMH for development and operation of the peer support specialist program. And then it notes that while the appropriations committee removed portions of the bill creating peer operated respite centers, it continues to be this committee's recommendation that $2 million be appropriated in FY23 for new peer-operated respite centers, whether operating singly or in collaboration with a peer-run or peer-led community center, and or expanding existing peer-operated organizations such as Pathways to add respite services.
Madam Chair?
Yes.
Yes.
I was just gonna, should we interrupt or wait for Jen? Is it okay to?
I think it would probably be useful to
interrupt during-
Interrupt now is better.
So S91, since you have the note about 195, I think it's appropriate to include a note about S91 saying similarly, the appropriation was removed from the bill by Senate appropriations.
Katie feels why
Yeah, and some of this 8.55 is one time and some of it is base funding. So Nolan should have that breakdown. I think it's 1.5 base and 3.77. The 8.55 seems high to me. Is that, so I think it's 3.77 one time and 1.5 base. Is that right, Nolan?
Yeah, 12.5 days, yeah, it's in the sheet. You look at the other sheet,
It's on the.
The original, sorry.
on-
You see the old one.
Right.
Yeah, I don't know.
Oh, okay.
I haven't actually found
Oh,
it.
okay, that could be filled in. That-
Anyway,
We can totally fix. This has
Yeah,
been some of Katie's stuff, so I am not familiar with the, oh, yeah. But then Nolan, your note says the Senate Health and Welfare version appropriates,
So you look at this.
Right.
1.5 grant.
then where's, so how is, I don't understand why this says 8.55 then, if this one says 4.85.
Because you add together. The total,
Oh,
That-
plus the 3.7, I see, 4.85 plus 3.7 is what you're saying.
it should be 1.5 million. If we're gonna do an apples to apples comparison, it's what the addition is to the base.
yeah, I was trying to capture all the movement.
Yeah, I think it's confusing because
I
it's
agree.
not 8.55,
I
it's way
see.
more than
Okay.
what it should be 1.5 million
The existing grant.
general fund base and then 3.7 one-time funding. That's what the bill
If you look
contains.
at this one and the versus that one, it's a little clearer. So if you look at,
3.7 on that.
this
Yeah.
one's a little clearer than that one. So.
Okay.
And again, the
Yes,
approvals took it out of the
Bruce, I
bill.
think this is a really good these are good distinctions to be made.
Because it looks like more than.
Yeah.
Okay.
And it's nice to have it broken down.
All right,
Cheryl, go ahead. No, just keep it between us in case.
So that'll go in notes.
Yes.
That makes
But,
sense.
yes, except that, yeah, so I think maybe what we'll say is the Senate Health and Welfare Committee report appropriated. And that is
It's 5.2, I think.
5.2?
Yeah,
Yes, 5.2,
Two.
okay. And then in the notes, is that what you want in the notes to specify that's the
That breakdown.
5.2 is breakdown? Okay.
yeah, and then that
Um,
approach took it out.
okay. Okay,
Great,
great,
thanks.
thank you.
And if I may make another point,
Yeah, go ahead.
this one's related to the next one,
Okay.
the 195.
Uh-huh.
I've been making the point in the House, and I think it's sort of slipped in the Senate, that even though you took all the appropriation, there could still be costs for the contracting that are in there. It's not referenced. I say it could be as much as 75,000. So the bill requires them to do a contract, but doesn't give them any money to actually
Right.
contract.
Right.
So as joint fiscal, I have to just reiterate at that point. I mean, so putting your letter is a whole other thing, but I feel like it's a point that got lost as the money was stripped out. But there's still a cost, even though they're appropriations.
So maybe we should put that in under amount.
You could put it under notes, you could put it in amount, you could just like FO is flagged, you know, whatever, but there's contracting costs, and so I
And so
estimate.
just simply say, in
Between
addition, there may be contracting costs.
50 and 75.
Yeah,
Could be as much as 50 to 75.
okay, that's good. All right. Okay.
Now, thinking maybe instead of writing on this thing, we should just take these in as we go. and
Yes,
we'll
well,
do
that's
even better. All right. So at the top of page 2, the next bill referred to as S285. And that one appropriates, as passed by the Senate, so I want to be clear because it, excuse me, the money did come through, come out of Senate appropriations as well. Appropriates $5 million, of which $4.45 million is to the Vermont Care Board for payment and delivery system reform and federal waiver of waivers,
right.
and $550,000 is to AHS for federal waivers. And then I put in the notes that the Senate appropriations amendment would appropriate $1 million to the Vermont Care Board directly and hold the remaining $3.45 million until the fall for HROC's approval of the plan and timeline.
So 4.45 and 500 equal 5 or 5.
Yeah.
Wouldn't it be 4? Oh, I see. Okay, yeah, that's sorry.
Okay.
I was
Yeah,
getting
generally, I'm not confident in my math skills, but pretty good. All right, so then we get to some priority bills referred to this committee, but that may not be all the way through yet, so we don't know quite what's happened to them.
So it's H265.
Oh. All right, and so that would appropriate $120,000 to the Office of the Child, Youth, and Family Advocate in fiscal year 23. And the notes specify that the amount appropriated in the bill for FY23 only anticipates the office operating for half of the fiscal year, beginning January 1st of 23. So the annualized cost would be $240,000. The House passed the bill in 2021, so there is no appropriation in the current budget. Okay, that seems like an important note. It next is H464, the Recheck bill. And the House version appropriates $500,000 for IT improvements to DCF. And then in the notes it says, in anticipation, in addition, there is a $130,000 impact for postponing anticipated savings related to eliminating the medical review team until January 1st, 2024.
That 500,000 is still an insane number, but
Can you remind me why, I know we went over this with the bill, but why we were postponing the anticipated savings? Because it came out, then it went back in.
So we're talking about
The H464, the Recheck bill.
Yeah, I think, I have to defer to Katie on that, but I think it had to do with the way the language was written. It was too complicated to move the effective dates around, and it was all done at the last minute with some pieces. So I would defer Katie to explain that, why they left it in versus doing the savings now.
Okay. Because they originally took it out and then they had to put it back in, and so it was confusing.
It might have been just the way it was drafted, and it was too complicated to move too many effective dates the way again.
Okay.
I would defer to Katie.
I'll ask Katie when we go over the bill.
Explain that, or if there's some reason in the house that I'm not aware of. I can't say I'm sorry.
Okay.
Okay. Next is H655, the telehealth licensure and registration system. And that would appropriate $360,000 to OPR to set up a telehealth licensure and registration system. That bill is currently in the Finance Committee. So maybe I'll just note that. So
You got it this morning?
Uh, Got it, yeah, so you got it last week, you have it
Yeah, you
scheduled
got
for
it.
Thursday.
Yeah.
So I guess for all my revenue this week again.
Everything's going fast.
All right. So I'm just noting, I added a note to say Bill is current
Of
appropriations. Yeah.
It has a
Okay,
bit to
so let
go.
me check on that, make sure we've.
Yeah.
Because it may have come over after we did the
Do you want me
agenda.
to give you a little sticky?
I'll email.
Oh, no, I'm not trying to pressure you, I
That's easier.
saw him sitting right here. Next one is H720, the Developmental Disabilities System. And this, the House version appropriates $102,000 to Dale to create a limited service position and $500,000 to develop pilot planning grants. And it notes that the monies appropriated in this bill are from the Home and Community-Based Services, it says FMAP funds. Is that the FMAP increase?
No, it has to do with this formula where we got this bump.
And we'll just call it that.
Yeah.
Just like, I don't want to know.
Well, it did, we don't
Can
need
we,
this.
can we add here a sentence that refers to what you put in intro about the possibility of housing funds?
Sure.
Oh, good idea. Yeah, because I was thinking that, well, but then that's not there.
And,
It's on for Thursday.
yes. And just, because I think there's
Yes.
lots of potential there, and I don't want it to get lost.
Mr. Langell.
This actually just caught something on 464.
Huh?
I just caught something on 464 that's lagged. It has effective dates for fiscal year 24. So there's no 23 impact, but it has 24 impacts. I don't know if you do or do not want to mention that in your letter, but it is in the fiscal note.
Okay,
There's no
so,
cost this year, there's cost next year.
So the 500,000 for the IT improvements is for 2024?
The IT improvements are for 23, and then there's another 112, and then it's annualized. 140 to 160,000 half-year costs in 24, which are annualized to between 280 and 300. So it has,
But is some of that offset by, oh no, it's the impact for.
no,
I don't think we need to get into those
Okay.
weeds in this memo.
that was what my point was. I wanted to flag it for you. I didn't know if you
Yeah.
want to mention it, but there are out-year costs, and I don't know how or if you want to include them.
so I think that this is a bill that both finance and approach, it'll be an approach, but I think finance is gonna have
It just seems that you want to
to
be,
look at that fiscal note.
if you're going to talk about things, it's like, depends on how.
Well, they'll presumably be looking more at the fiscal note when they actually look at the bill as opposed to just
Yeah.
you noting your priorities.
Yes,
It's so much just seemed disingenuous.
yeah, no, good.
The reach, have we gotten testimony about the IT costs yet?
I think so. We'll double check.
Yeah, just because, I mean, I hear Josh's concerns, and so we should just make sure.
Put a little star by it.
I remember some testimony about 3 separate technicians and.
Right.
There was some explanation.
Yes, there was, but, and the question was how integral is it
We
to
want to see a budget.
IT systems,
I
right?
believe I have a document in my files,
Yeah,
but
yeah,
you should hear from them or leave it to appropriations to hear from them.
okay.
But I think it's safe to assume there would be costs.
There always there's always a.
Okay, so we've added the housing piece with H720.
Yes, so I put Senate Appropriations Committee may want to look at whether housing funds can be used for and maybe put housing pilots in the intro, so but I've highlighted that because I don't know if that's what the pilot planning grants are. I just want to get
And long-term housing costs, housing development costs, because I think,
housing pilots and housing development costs.
yeah.
Okay,
One of these pilots leads to an actual thing. And I think there's possibility that it could be funded through house money.
Okay, then we have 728, which is the opioid overdose response. And the House version appropriates 880,000 to the health department in one-time funds. Is that from three pilot programs or
Probably
four?
four.
And you want to add something here about looking at the 7-Eleven?
Yeah, I do. I think that, keep it consistent. So,
Have we looked at 728 yet?
yeah, once, I think, or we're looking at it Friday.
I don't
Have we
remember.
looked at 728? We're looking at it Friday.
We did go over
After
it
you
the
read
first
these
time.
things, you forget. Hang on a sec.
Do you remember it?
728, is a Friday, we're getting, we are getting testimony.
We had a walk through.
Read it, yeah.
Okay. I mean,
This is the
since
one.
we haven't finished our work on these bills, I'm a little
We'll be good. We'll be fine.
hesitant. We might want to say, we may end up wanting to recommend more money than that, or
We
less
might.
money than
We
that.
might.
So that's why I'm a little hesitant to put something definitive in here.
Okay, well, it says House version appropriate, so do you want to
Yeah.
say SHW is still considering this bill or something like that?
Yep.
Yeah, that sounds good.
Yeah, I don't know if you want to do that for, if there are others you want to do that.
We're almost
So-
done.
I mean, where the reach out and the DD bill, and for all of them really get finalized.
Well, I think some of them are probably more flexible than others, so.
Yeah.
Could put a general statement in the beginning that.
Do you want to say that for 464, because it sounded like there were potentially concerns about the cost of the IT?
Yes, we could do that. And then for the opioid, if we put 7-Eleven in there and that the committee is still making decisions on policy recommendations and financing.
I'm sorry, can you say that, can you say that again?
Huh?
Yeah, I was typing and I.
I was just gonna say on 728, that we could say this, the committee is in the process of making policy and appropriations recommendations. But then we would also have in there
Right, so I just put under amount, it still says House version appropriates 880,000 in one-time funds for 3 pilot programs. I put semicolon, SHW is still considering this bill.
yes,
And then in the notes, I said, SAC, Senate Appropriations Committee, may want to look at whether opioid settlement funds and the opioid abatement special fund to be established in H711 can be used for costs in this bill.
okay. So, are we good? To this point? Okay. What I'm gonna suggest is Monica Hutt, our Chief Prevention Officer, is on Zoom and available. And we're moving into the section that includes substance misuse and prevention issues. Why don't we stop for about 15 minutes and hear from Monica? 10, 15 minutes, we'll hear from Monica, and then we'll come back to go through continue through our list of recommendations. That way we've got the information up front before we dive in.
What is she talking about, the bill or the budget request?
Substance misuse, the budget request, prevention council, where things are. We haven't heard them, so we'll do that. So is Monica there?
She's waiting.
Yes, please.
Okay. Here she comes.
There she is. Good morning.
Good morning. Let me just shut my door. Excuse me 1 second. Okay.
All right, so Chief Prevention Officer Hutt, that's your official title, and we're pleased to have you here. Well, we're going through our budget priorities today, and we've asked you to come in and talk a little bit about what's happening with prevention, because we haven't heard up front. I know there's money in the budget currently. I know that the Prevention Council has been doing some work, but it would be helpful for us to hear from you. And I'm looking to see if you haven't sent anything in yet to Aaron, but maybe we could get some written testimony that will help us. But before that, why don't you go ahead with information about budget requests, Prevention Council, and what the needs are, what the work is that's been done, and then what the needs are going forward.
Absolutely. And if I start to drift afield, wave or stop me and redirect me to where you want me to be, because I also know that you all have a limited amount of time. And I'm sorry, I should have started with good morning, everybody. Thank you for having me. Monica Hutt, I'm the Chief Prevention Officer for the state of Vermont, and I sit in the governor's office. And I apologize, I was hoping to come over and be in person, but Aaron let me know that you were kind of chock-a-block full in the room. So hopefully I'll be able to see you another time in person.
Yeah, that would be great. And we never know. We're one short of full house today, so it could have happened, but we never know.
Want to make sure there's enough air moving around for sure. So I wanted to just talk a little bit about the role, just to sort of start large, and then I'll shrink into the specific questions, Senator Lyons, that you just asked, if that's okay.
Fine.
Great. So folks will recall that this Chief Prevention Officer role was created through Act 82 in 2019. And I stepped into it just last year, so just February. So I've been in it just a year, but I am so appreciative of it, because to me, it really represents this commitment on behalf of both the legislature and the governor to really focus us on prevention, which, as you all know, is something that always gets kind of short shrift when we're thinking about the work that's in front of us and the immediate kind of house on fire situations that we tend to find ourselves in human services. And so for me, it was an absolute luxury and a blessing to feel like this role was meant to be focused on upstream, although as all of you kind of experience the push and pull of that in the moment. It was created after the Opioid Coordinating Council ended. And so the initial connection was around substance use and misuse, certainly opiates, but even more broad, looking across substances. But the way that the language is written in Act 82 and in conversations that I had actually with Senator Lyons and with some other legislators on the House side, it was really clear that the intention from the legislative side was to be even broader than substances. So to think about all of the things that we try to prevent in human services, everything from substance use and overdose deaths to death by suicide, to homelessness, to the experience that children have when we think about all of those adverse childhood experiences, those ACEs. Prevention of domestic violence, prevention of falls for older Vermonters, prevention of health inequities. So it really is meant to be broad. And when I think and talk about it to people now, I have come to realize that where it makes most sense is to talk about kind of flipping it around and thinking about the pursuit of health and wellness. How do we address all of those social determinants of health? How do we build resiliency, strength, and wellness in our communities so that the things that we're trying to prevent aren't so dominant in our culture, aren't so dominant on the landscape? So it really is trying to be upstream. The role itself and the things that I've been engaged in are certainly and primarily the Substance Misuse Prevention Council, which is a group that, again, was created after the Opioid Coordinating Council ended. But also I've been doing a tremendous amount of work in our after school on the Interagency Council to create after school and summer opportunities for Vermont's kids, particularly as we come out of the pandemic and look to recovery, but also because after school is one of those key prevention, protective factors. It builds resilience in kids and supports our families. I'm working on the Health Equities Advisory Council, so working to prevent and address those health inequities, particularly for Vermonters of color, but recognizing that it also impacts individuals with disabilities, our LGBT community, our older Vermonters. So looking at the health disparities across the state of Vermont and how do we begin to address those. Suicide prevention has been a huge area of focus for me over the course of my history in state government and again in this role. And in fact, at some point in time, I'd love to talk with you all a little bit more, because in addition to the suicide prevention work that the state of Vermont is doing, in addition to additional funding in the governor's recommend and the Department of Mental Health stepping even more fully into our zero suicide work, we just signed on to work with SAMHSA and the Veterans Administration to try to address suicide prevention for veterans, service members, and their families as part of a governor's challenge. So that's really exciting. And we literally are just kicking that off just last week and really stepping into an intense focus with SAMHSA and the VA starting next week. So also on the Rural Workforce Project Leadership Team for substance use and recovery, but workforce issues in general have been an area of focus for me in this role, because again, this is nothing you haven't already heard, but we've got some pretty significant workforce issues across our workforce, particularly in human services and health. Also, of course, in the trades and really everywhere. But really the impact in our human services field is pretty significant right now. And so trying to address that. Working a lot with cannabis policy right now as the cannabis adult use market comes online. Trying to work with the Substance Misuse Prevention Council, but also more generally around some of our cannabis policy and practice. How do we get ahead of this so that cannabis doesn't become the next issue that we're looking at addiction with, and trying to make sure that the structure here in Vermont is built in the safest possible way. And really grateful for our Cannabis Control Board colleagues, because they are very much thinking about that as they are making decisions, as is all of the legislature in terms of really careful thought. The opioid settlement money is coming into the state, and there's been a lot of work over the last year to make sure that we've got a great and solid structure to accept those dollars and to use those effectively. Also working with the transitional housing, the emergency housing program, refugee resettlement, co-occurring issues with mental health. There's the Buprenorphine task force. Folks may recall that there was legislation last session that decriminalized a certain amount of buprenorphine, and trying to understand what the impact of that legislation was, because it in fact sunsets in 2 years. So wanting to really understand, did that have a positive impact in terms of reducing overdose deaths? Did it have a negative impact? Did it have no impact? So wanting to make sure that we've got good data and information about that, so that when the sunset date rolls around, we can make good decisions. And I work closely still with all of the agents or all of the departments at the Agency of Human Services, which I'm very grateful for, because those are all of my colleagues and the work that I feel really passionate about. So specifically thinking about the Substance Misuse Prevention Council, that body is a large body, and really its role is to review policy, review practices across the state, to make recommendations about policy and practice, to build partnerships across the community so that work can be integrated, and to support the community efforts and the coordination in community. And that council, I think in this last year, which is when I've been obviously most engaged, but they were going through their own developmental growing and changing. And so in this year, it feels to me like they've really hit their stride in terms of really thinking about prevention, but also recognizing the aspects of prevention that are present even in our recovery work across the state, and in thinking about the enlargement of the focus across substances. So certainly opioids remains a significant issue, but Vermont continues to have really significant problems with alcohol use. Methamphetamines are kind of resurging, and cocaine. We have never stepped away from the issues that we've had with tobacco. And for our young people in particular, the issue of vaping is a really significant one. So we know that the issue of substance use and misuse is across substances, and trying to maintain equal focus on opioids and those other substances that remain part of the picture in Vermont. So that has been a tremendous amount of work on the council over this last year, bringing in intervention, treatment, and recovery as a conversation, even within prevention, so that we're building a continuum and not kind of segmenting ourselves into different areas of focus. And really, again, thinking about the cannabis policy in that group, trying to get ahead of data and create a watch list of the data points so that we can make sure that our efforts around prevention and enforcement and regulation are targeted to data, so that we're linking the two things and not disconnecting them. So I'll pause there for any comments or questions, and then I can talk a little bit more about, I think, Senator, that what you wanted me to speak to was specifically the substance use package or proposal in the governor's recommend, and kind of what's happened to that over the last few months.
Yeah, I think that would be helpful. Your overview has been terrific. And so why don't you go ahead? We have money we're looking at here for Substance Misuse Prevention Council. And then of course there's a tobacco control program that the larger coalition, not the council itself, but others have been utilizing, and it's in the budget as a one-time funding process, but we know that the demand is greater than one time. But so just to hear your comments on the budget piece.
Absolutely, I'm happy to. So the governor's recommend was, I obviously I'm a little bit biased, right? But I was incredibly pleased because it felt like the governor's recommended budget really tried to address substance use on that continuum that I just talked about, right? It was really looking to put dollars into prevention, into treatment and intervention, and into recovery efforts. And the opportunity to spend dollars on prevention, again, to me is one of those really transformational, once in a lifetime opportunities. One thing I want to correct, because I realize that it's mistyped, I think, in the big bill, and I think it's causing some part of the confusion. The governor's recommend had $3.5 million, not for the Substance Misuse Prevention Council, but for Substance Misuse Prevention Coalitions, which are local bodies across the state. There are many of them across the state, but the proposal was to fund 12 of those local coalitions. So those are the coalitions in communities working with schools, working with municipalities, working with rec centers, working with their recovery centers to actually build the education and prevention efforts locally. They partner with the Vermont Department of Health has 12 prevention consultants, one for each AHS district. And the idea was that we would partner with these local coalitions to really be the arm in the community. And I feel like that one typo has created, and I tried to correct it and was unsuccessful, because once the budget launches, it's a little hard to pull the language back.
We'll look at that. We'll try to correct that, because it sounds like something that is extremely.
I know what. Right. What would the council do with all that money? That sounds like a bureaucratic spend, and that's absolutely not it.
Yeah, no, so it's the coalition, and you're identifying it as the 12 local coalitions.
And there are more than 12 local coalitions right now. I will just say that, because they spring up. Again, it's very grassroots in a lot of ways. And all of the coalitions are very dependent on federal funding. So whether it's tobacco funding or alcohol prevention or opioid prevention, it's based on the Vermont Department of Health ability to secure federal dollars. And so what has happened, and this is what I learned over this year of my time in this role, is that those coalitions come into being with their funding and they're specific to one area. And then when that funding isn't sustained at a federal level, sometimes they actually disband and then they are recreated again and again. So this funding was meant to really stabilize at least 12 so that they could be continuous, constant, effective presences in their local communities and be responsive to community need, and then layer on additional federal funding if there were initiatives around alcohol or tobacco or vaping. But to stabilize them in the way that we stabilize the rest of our service system, to ensure that prevention isn't whimsical or based on the vagrancies of federal funding, but actually stabilized in the state. And I was incredibly excited about that opportunity.
So I think there's a question from Senator Hardy, and then we'll make a comment. Go ahead.
Okay. Thanks, Monica. I have a couple questions. That was helpful to understand the difference between the council and the coalitions. But we're also hearing that there's a collaborative. So who is the collaborative?
A couple of the local coalitions have named themselves collaboratives. And I think it's really a nod to the fact that they pull local partners together. So whether they've got their hospitals or their schools or the recovery centers all sitting together. So there are a couple of structures, and this is where it would be wonderful to have the Vermont Department of Health, the ADAP division, come in to really talk with you to be specific, because ADAP has been trying to create some structures not dissimilar to this with federal funding. So collaboratives that could be clearinghouses for information coming in, could support more of the local work. So the interplay between those and the collaborative is often the coalition, but I think it's, I'm hearing myself talk and I'm realizing how confusing it is.
It's really confusing. So the collaborative is a collaborative of a bunch of coalitions. It would be nice to have a map. Senator Cummings and I like flowcharts. So something that explains, because that has gotten super confusing in the conversation about this, all these C words that are really lovely C words, but there seems to be subtle differences between each of them and it's hard to tell. But my other question is a little bit more substantive, and that is, you said that these coalitions sort of spring up and then die down depending on federal funding, and I get that. But who is overseeing the sort of approach that they're using? As you know better than I do, there are some approaches to prevention that are more effective and some that are actually harmful, but seem to get kind of used more than I would like. And I'm wondering, what is the sort of quality control on their efforts at the local level to make sure that they're using best practices and inclusive language and harm reduction rather than blame, et cetera?
Yeah, so I will say, Senator, that first of all, they hold themselves through their work together as a network of coalitions, and Prevention Works Vermont is the kind of the association for all of the local coalitions, whether or not they're funded through the Department of Health. But they certainly hold themselves accountable. And any federal funding that flows to them, as you all well know, has really strict rules around evidence-based practices. So all of the work that they do is required to be evidence-based. If there is an additional ADAP funding or state funding, ADAP holds them very accountable. And so there's multiple levels of accountability that holds them to evidence-based practices. With that said, building a network in the way that we're talking about, I think takes us even more steps in that direction towards a really systemic menu of practices that you could pull from depending on what area you were targeting in your community. But all of the coalitions operate under strict rules around evidence-based practices. And that has also been one of my major learnings over this last year. ADAP, which is actually, hopefully there will be a name change in that department. But so the Division of Alcohol and Drug Use Programs can speak really more directly to this and be a little bit even more in depth about it than I can.
All right, well, it would be helpful to get some more information about that, because just speaking from my own experience as a mother whose kids have been in school for some of these programs, some of them are clearly not evidence-based and are not very well done, bringing enormous puppets into school and scaring kids about drugs, for example. And it really scarred my kids, frankly. They're still scared of huge puppets because of this. So I just want to make sure that it's real, actual, impactful, evidence-based harm reduction, not scaring kids about drugs.
Absolutely. I couldn't agree with you more.
Okay, thanks.
So I think the question is, can you send us some language that would be helpful? It sounds like changing that language to coalition rather than prevention council
Can
is
you ask her where
important.
that is? Like, I'm just sending her email. I can't find where that error is. Can you ask her where specifically
It'd
that
be
error is?
313.
No, we looked.
We looked, it's not there. So where in the budget is the Substance Misuse Prevention Council discussion or reference that you're talking about? That's the question.
So I will admit that I have a kind of a pullout from the budget and it doesn't show me where it comes from. Was that Jen Carby on the side?
Yes, it is. Yes, it is.
Monica,
Hey Jen, let me try to find where it is in the big bill. I don't have the
I was-
actual.
I was halfway through sending you an email, so I'll just continue the email and then you can respond.
Perfect. Thank you.
Okay, that's good. I think this is helpful. I've heard there've been some problems along the way, so this will help. Maybe we can help. We never know. Senator Hooker has a question.
Thank you, Monica. With regard to the base funding for the 12 locals, how are they determined? You mentioned that there were a lot of coalitions. How are these 12 determined?
And unfortunately, this is where it's going a little bit deeper because this is part of the VDH budget, the Vermont Department of Health budget. So they have the budget details. I know that Deputy Commissioner Dougherty is going to be in the building on Friday testifying, and maybe it would be helpful for you to, I don't know if you've got her scheduled or if she's in a different committee, but she would be able to break that down a little bit more because they were trying to make sure that they could fund at least 12. Well, no, not at least. They were looking to make sure that they could fund 12, knowing that that's not funding for every single coalition that's out there, because there are many that are small and, as I said, sort of have sprung up on their own. But to try to stabilize both the funding and the practice across 12 different coalitions that would link to the VDH prevention consultants, they had a breakdown for what that would take in terms of these state general fund dollars and then making sure that they were leveraging federal dollars wherever they could. But I don't have the specifics on that, unfortunately.
So, and our memo is probably going to go out before Friday, and we will have VDH folks in on Friday, but maybe we can get some clarity on that. And some of the clarity will have to happen in appropriations going forward, but this helps us understand your perspective and how the prevention dollars are being allocated. And if we can get something in writing and maybe the flow chart, that would be very helpful.
Yes, I will work with VDH to get some of those questions answered for sure.
Oh, thank you. That'd be great.
Absolutely.
Okay, so why don't you go ahead for another couple of minutes?
Sure. So the governors recommend, we talked about that 3.5 that was dedicated to prevention. And then I know that you've seen, what's happened I'm not even sure what version of the budget you're looking at right now, but there have been some recommended changes to that. The next piece of the governor's recommend was in that, remember I told you that there was a continuum. So that next section of the continuum is in the intervention and treatment area. So there was 3.7 million broken down into residential treatment beds, recovery beds, and sober beds, to really try to, because one of the things that I have certainly heard over the last year is that there is a lack of available beds for those emergency needs. When somebody's ready to come into treatment, they're ready in that moment, and you want to kind of seize on that opportunity. So making sure that you can get people into treatment, residential treatment, but also to have those beds available for a step down out of residential treatment back into community, because it's such a critical time in somebody's journey to recovery, after they've received that immediate residential treatment and then need a safe place to land in community, right, to continue and to then link to those additional community services. So that was the piece of the budget that was really dedicated to intervention and treatment. And then the final piece of the budget, or one final piece of the budget, was in the recovery. There was a pilot recommended in the Chittenden County area around employment. And those of you that know me know how strongly I feel about supported employment for individuals with disabilities. It completely applies when you're thinking about folks that are coming out of residential and community treatment around addiction. The idea of being able to be employed, of having a workplace that is supportive of you, that it's critical in someone's journey for employment to be a part of that. I really firmly believe that where we work is our network, it's our support, it's our community in a really real way. And frankly, it costs money to live. And so if you don't have the resources that you need, then the risk of a relapse is much more significant. So an employment pilot specifically in Chittenden County, which I believe as part of the process through the House and into the Senate, was expanded pretty significantly so that it would link to more recovery centers than just the Chittenden County Recovery Center.
So this is one of those things that, of course, that we would probably fully support, but hasn't actually come through our committee. But we've been talking every year about crisis beds and step down beds and support for folks who are in recovery. So this is very helpful. Thank you.
You're welcome. And for me, it all links back to prevention, because you can prevent the initial use, but then you also have to prevent reuse or relapse, right?
That's very good.
I figured out a way to make the whole world fall under my title right now. So I'm delighted about that, because
that's why you're there.
And then the final piece of the governor's recommend was funding for Jenna's house, which is a really unique pilot happening in Johnson right now. It's actually almost a community or a village model for recovery, where they are working to offer everything from medicated assisted treatment to recovery beds to employment opportunities, counseling, transportation. They're building this entire village essentially around recovery to support individuals on that journey. And it's very new. It's services that exist across the state in different places. It's the one place where it's being brought all together. And so 2 or 3 years of pilot support for that to see how it works, how to make sure that it is in fact evidence-based and linked to best practices, and then whether or not it's replicable across the state. That was the fourth piece of the governor's recommended budget around this whole substance use proposal.
Where is that village?
It's in Johnson.
Johnson, okay. Okay, so thank you. This is helpful. If we can get something in writing around the prevention coalitions, that will help us. And then we'll be going through SH 728 again with VDH, so we'll have an understanding of any relationship there. There are other requests that we've had in our committee for recovery, in particular one for justice involved folks, or people coming out of corrections who might need a slightly different recovery model from others. And I don't know whether you've been looking at that or not.
It's not an area I've delved into quite as much. I know in talking with the Vermont Department of Health and Cindy Seabright, who is the director at ADAP, what Cindy has said to me is that work is happening right now. And so I don't know, I'm not understanding fully if the proposal is to increase that or to expand it. I would need to know a little bit more about that to be able to give you any real insight from my end.
Okay, all right, thank you.
Sure.
So any final questions for our Chief Prevention Officer? We're good. Thank you for taking the time to put this all together and bring it to us. We appreciate it. And if we can get something in writing, that'll help us even more.
Absolutely. Thank you so much for having me.
Yeah, terrific. So don't worry, you'll be back.
Thank you.
Thank you very much. Okay.
Bye.
Take care. So Katie is here. And so FYI for everyone in the room, we have 9 people.
Oh.
No, but we made a categorical decision to reduce it from 10. And I think it's okay unless you are uncomfortable. So. Okay, well, let's go. All right, so Katie, there was a question about the Recheck bill.
Okay.
And I'm wondering if you wouldn't mind taking the hot seat for a minute. And then Ruth, it was your question, so why don't you go ahead with it on Recheck. We were talking about IT.
Oh,
And
it was
maybe
Josh's question.
It was the 130, why it was left in.
Oh,
Yeah.
that was my question, right?
Yeah,
And then
there were
Josh
a
had
couple
an
of
IT
questions.
question.
Oh, okay.
But, yeah.
Should I pull up the bill? I think I could answer it.
So, yeah,
So why aren't they getting the 130 savings this year?
Yeah, it seemed like it was in then out,
Yeah.
or went back and forth.
So,
They leave it as.
yeah, so at the very 11th hour, the department was asking for a delay in the effective date in those sections. The bill is introduced, had sort of a standalone section that struck out the medical review. And as the bill went through the process, remember all the changes we talked about that like were more goal oriented and collaborative. So that section where that medical review language was, got a total revamp. And while it's still struck, it's sort of like one component in a much bigger change in that section now. So that's sort of why it was the combination of coming at the very last minute and pushing the effective date out and then not having really the time to sort of splice out a tiny little section that would go into effect right now. And instead the decision was made that all of those changes that have to do with the goal-oriented sort of perspective and all of the changes integrated would be a package that went into effect on one date instead of having one little section going into effect at a different date. So that was sort of a combination of timing and where it was didn't make it easy to sort of pull out quickly. If you were interested in pulling it out quickly, what could probably be done is we would amend that section. We'd amend the section twice. We'd amend it to just remove the medical review language, and that would take effect now or July 1, and then keep the other changes that would take effect January 1, 24. So that would sort of be the alternative option, either treat it as a package or pull that one piece out.
so we have this bill up on Thursday morning, so if there's so maybe we can look at it before then. Maybe folks who are going to testify might have something to say about that.
Okay, I would just say if you're thinking of going in that direction, maybe just give me a heads up because it will take whatever I'm playing with chapter dates. I sort of want to have some time to think about it to make sure I'm making everything go into effect at the right time.
Okay, let's do this. We'll leave it for now, and then we'll come back to it with a little bit of time, if we have time at the end of today.
Great.
We'll just talk collectively and make that decision. Okay. Okay, so let's move on.
IT.
Huh?
IT.
Oh, the IT question.
That was, why is it so much?
Yeah, I mean, you gave us a bit of an explanation the other day. I just still can't, I don't want to, beat the dead horse here, but I just can't get over the fact that they want $500,000 from these IT upgrades and changes and so on to implement this program. It just seems like such a tremendous amount of money.
I think you have to hear from them. I don't think
Yeah,
either
we've
Nolan
got
and I
them
know enough
coming in.
about what the money exactly is.
Coming in
But I
Thursday.
think DCF could probably give you a breakdown.
Yeah,
Wednesday.
Kettering, we've got the senior advisor for DCF, and we have Recheck, program director for DCF coming in on Thursday. So
Might I suggest that maybe Aaron reach out to them and ask them to come prepared to specifically answer that question?
Answer both of those questions.
yeah, let's get both of the
And did we already decide, Jen, to put language in saying we're still considering this bill? Basically, because
This one is 460.
Well, maybe we could put a little star next to the bills that we're
Yes.
still considering, and then just have that general statement underneath.
yeah, because this one seems to have the potential that we could make changes that would
Yes.
affect the appropriations.
Yeah. Okay, we'll do that. And then Aaron, we're gonna reach out to Trish, but, all right, we're good. So let's move on, and we're gonna go through, beginning on page 3. Just go through what we have here, and do you wanna sit with Katie, or?
Yeah, you did with that?
sure, I'm not
Wanna
sure
do it together?
where exactly we are, but I'll figure it out with that.
We're right at the top of page 3. We went through the bills, and so the questions you got were, as a result of doing that.
Okay.
And now we're going through,
Yes, there's this at the top.
the other
And
things
the priorities
that are on our list.
Probably. I thought. Okay, so these are the funding priorities outside of the bills that you've either worked on or are working on.
So I saw that very first one, just to jump in here, did say Substance Misuse Prevention Council, so I changed it to coalition because that's the 3.5 million. So I don't know if that's what part of it she was looking at or what we based that on, but it now says coalition.
I think the discrepancy was actually in the ups and downs, because the ups and downs has it as a council. So it's not consistent throughout all the documentation.
But at least yours will talk about the coalition.
Switch, I didn't hear that last.
So I just changed it so the way you're looking at it at the moment on your version says Substance Misuse Prevention Council, but I changed that word to coalition because I recognize the 3.5 million in that budget section.
I don't feel like I know enough to say whether I recommend this 3.5 million. I'm skeptical of it, frankly.
Oh, I think it's great. I think it's really a real step in the right direction in terms of prevention. But what we'll do is we'll look at what Monica Hutt sends us, and then.
Why did the House reduce it to 612,500? I mean, that's a huge reduction, so they must have had a reason to do that.
Is that just for the council?
That's because it was
Yeah.
council. I think there was some confusion
Maybe that is,
about
maybe
the
that's,
council versus the coalitions out in the local community.
maybe they looked at that,
Yeah.
depending on what they were looking at, they may have looked at it and said, 3.5 million for the council, like
Yeah,
Monica said, is a lot.
I'll
Right.
follow up with them to see, I'll check in with.
yeah, that would be helpful because I don't feel like I have enough information to justify the 3.5 million. I don't know what they're doing enough. And while she assured us that it's evidence-based, I'd like to see more documentation of that. I mean, I know that there are very well-intentioned community coalitions that try to do prevention work. And
But they can't,
they don't use best practices, even if they get federal money. I mean, so I need more information before I could say, yes, let's put $3.5 million into this.
I'm fine with it, but I think getting information from Monica Hutt will help. Remembering that whenever there's a grant that's given out, there is accountability and responsibility associated with that. There may be coalitions in our local municipalities that are not grant driven, but rather are municipally developed. So I have some.
These are grant these working in schools that I just I need more assurances.
Well, and I think we need to know where these coalitions are that
Yeah.
are going to be funded,
Well,
because.
we're gonna get that information, so.
So I would just put an asterisk next to this one. I'm not 100% comfortable.
I'm not, who I am happy putting in the coalitions and leaving it because it's a significant step forward in prevention. So after we get the information, then we can make a decision about whether we support or not. At this point, we can't say yes, no, anything, so.
But the budget is coming out on Friday.
And the budget's coming out
Yeah,
on Friday,
so
so
That is my mantra.
I'm a local coalition person, and I know in my district, there are people who are doing things that are not driven by specific evidence-based granting, but they are doing it with local money, municipal money, or school money. So there's a distinction between what we're funding here and what we might see that we, aren't happy about.
I have no doubt that there are really great programs out there in all of the state. I totally get that. I'm not saying that's not true, but I think that I need more reassurance about where this money is going. How are they determining which of these local coalitions are getting the money? What evidence-based work programs are they using? What is the oversight? Because there are programs that are funded not through local municipalities. That doesn't happen in rural towns. They don't have money for things like that. These are from state funded and federal funded grants that are
So if
using.
you could find some of those that you think.
Well, I want to hear from Monica what this money would go
Right,
for.
so what we heard was that there are 12 places that the Department of Health is located and oversees local coalitions and funding when grants are available. And if the grants aren't available, the coalitions dissolve. So we will get that information from her, and hopefully we'll get a little map and some of the information. And Erin, maybe send a note to Monica indicating that we would like to know how the programs, the coalition programs are monitored, what's the oversight for them, and how do we determine that they're evidence-based? That would be good. So, okay.
So I put your position as undecided. And are you still looking to explore a relationship to H728, or do these feel like?
Yes.
Totally different. Okay, then
Yeah.
we'll just leave that right as it is. The next one is the free and referral clinics. So these are other priority funding requests. These were things that came into the committee that the committee may be supporting depending on what you decide here. So the free and referral clinics asked for a 10% increase to their base grant from the health department. That would be $102,800. I think some of the thinking was maybe to support half that amount, 5% increase. So I did the math and put the number. Is that?
Yeah.
Just for the record, I wanted the full 10%, but we settled on the 5.
Did we vote to give 6 million to that?
Do we wish?
It's on this list.
It's on the list, yeah, it's at the top of this one, I just didn't.
Yeah, I went at the end of this one because I think it was a no, at least in that quantity.
Okay.
Can I ask, so we had talked about not putting the things on this list that are already in the budget. Because if we include some, but not all, it looks like we're prioritizing some just because we got an email about it. And so there are some things in here, for example, the CCFAP increase is in the budget already. And we're saying we support it, but we're not mentioning everything that's in the budget.
No.
Just got this is just on the list because we got an email about it.
Well, there are other reasons for the CCFAP, and that is the childcare issue that we've been so committed to. with Act 171. So for me, there are some things here that are critically important, whether or not they're in the budget.
Well, I mean, that one was just the first one that I saw.
Right, and I think.
Obviously, that one is a priority for me, but we are not listing every single thing that's in the budget and taking a position on it, so.
We might be careful because next year we may get emails on everything.
Exactly,
Right.
that's why I'm saying, like, maybe we don't wanna have everything that we just got an email about.
Well, let's go through and see what's here and then what is not, what you don't want to have in here. So I think as we went through this list, I think Senator Hardy and I, and then Jen and Katie and I went through the list and we can. So we're on the
We're on
healthcare.
healthcare advocate, and the proposal is to add 270,000 to the base and an additional 120,000 to the base for an additional attorney. House appropriated 270 in one-time funds. As I said, the advocate's office wants they to be an increase to their base, and the House did fund the additional 120 to hire the attorney. The thought was to support adding both of them to base funding, basically support the request from the healthcare advocate.
Did we get a sense from him what that new attorney would do? This,
In the letter,
Yes,
I think it just says their workload is increasing,
astronomical.
so I think that's,
it's not a specialized or anything, it's just an
it's in the
additional.
letter, I can tell you.
Okay,
The next one is Ahec primary care loan repayment. And I guess they're looking to add 793,000 to get back to the 2009 level of 1.46 million.
now I think this one is important, especially as we're looking at workforce, and it's also going to be in there will be some discussion with the workforce bill, but this one.
I think though that there is a whole bunch of money in the workforce bill for, I just wonder how there's a ton of money in there for nursing in particular. How
There's
does
for
this-
nursing, I think this is I'm not sure if this is the existing program that was created a couple of years ago, or if it's the given that the funding goes back to 2009, I think it's the longer standing Ahec. The
Primary care.
Yes, but there's a particular name of the program. Anyway,
Oh, I don't know, the loan repayment. What I will say though is in 703, yes, there's money, but it doesn't go to AHEC, it goes to DSAC, so it's.
Yeah,
Right.
there's a lot of work to
I
do
think
on.
this is what let's go to first is the state loan repayment program. And so I believe it's a fairly long-standing program that they do that is separate from the efforts that are going on in the workforce bill, which are really
Yes.
more focused on nursing and other types of work.
So what kind of providers get this?
This is, I think this is medical.
Primary care.
It's primary care.
It's been expanded a little bit.
There might be some dentists.
Child
I'm trying to
psychiatrist.
think, well, it's primary care. So let me just look up Vermont.
But it's still funded at a fairly low level.
So it looks like, well, I don't want to speak out of turn, so we may want to get Liz Cody to speak to this. There's the Vermont Educational Loan Repayment Program, and then that's the ELRP, maybe that's what this is. And that's for primary, this may be it, including physicians, advanced practice nurse practitioners, certified nurse midwives, physician assistants within the primary care one. And then they also administer the federally funded, that's the SLRP, the State Loan Repayment Program for primary care physicians and others working for FQHCs and rural health clinics. So those are the programs that Ahec is administering, specifically in the primary care area. I left out the references to non-primary care.
So, and this as compared with the workforce bill, which is different and which has a different set of funding opportunities that we'll look at. Most of that, we'll have some time next week to finish work on that. But this one is standalone and has been in effect for
I think it's before 2009.
25, 97, I think it started, but I went on the board after that.
Yeah, I know Liz Cody from Ahec testified in some of the House committees and likely down the hall as well.
Because the thing that they linked, at least several of them linked to in the email to us was from 2018. So they didn't provide current information about it.
Okay, so let's go on to the pre-apprenticeship program.
That's 100,000, and the ask is either for one-time or base. The funds are requested for the pre-apprenticeship program, but seems to be some money available if the early education group can carry forward funds. If that's the case, then only 60,000 is needed. And it looks like your position is to support as one-time funds. And then the next one is an increase in CCDOT. There's a 4.9 million increase to the base. The House supported the governor's recommendation, and your position is to support as well.
And then there's the tobacco control program. The proposal is for 612,500 to the base. The House budget gives that amount, but in one-time funds, and your position is agreeing with what's in the House version, support as one-time funds.
So interestingly enough, the Attorney General's office brings in, settlement funds, and we're seeing additional settlement funds this year that would support this. And they're probably getting more, but it would be great if we could increase the base, but I'm hesitant to do that at this point. Postpartum coverage.
Yep, so postpartum coverage, this would be 951,000 goes into base funding. The Budget Adjustment Act required AHS to ask or to seek a Medicaid state plan amendment to expand postpartum coverage for 12 months. This is an option that's made available from ARPA, but it's, I think it's for a 5-year option. So the process is moving forward, but this is the funding part of that coverage. So the position is support.
Yeah. It's all over the place for a while.
The next one is Vermont donor milk. It says coverage. I think it's center coverage.
I'm not sure, and I don't have Nolan's underlined.
Let's see. So donor milk.
Can I ask a question?
Milk coverage?
Yeah.
Vermont donor milk coverage, what is Vermont donor?
So donor milk, it's Vermont Donor Milk Center.
Maternal.
Donor milk is literally donated human breast milk.
Oh, okay.
If someone is not able to produce their own or their infant has certain medical conditions or that mother's milk is contraindicated. Yes, so this would be 50,000 in one-time funds. And the position was support. Next is home and community-based service provider rates. This one gets a little bit confusing because there's lots of different members happening in lots of different places. What you're being asked for right now is a 10% increase from the providers are requesting a 10% increase, which would be 22.9 million in general fund. The House appropriated 9.3 million in general funds. That represents a 7% increase. The governor's original recommendation was a 3% increase. And it sounded like perhaps there was support for the 10%, but highlighted it here because I don't know that there was.
Yeah, I don't know if
this
we'll
was
be able
around
to
the
get
10%.
10%, but it would be great if we could. I know the appropriations concerned about how much they can do, but I think we should continue to support it.
So a couple things, if 7% is 9.3, how is 10% 22.9?
So I can, so it's 16 million above the House. So the House did, so if the governor is 3%, was 15 million. House increased another 4, which brought it to 21 million. And then bringing it up another 3%, be another 15 million. So it's 16 million above the house.
Okay, I think that cleaning up that note would be
I tried
helpful.
once already. I'm happy to do it again. I think it's, yes.
It looks like the House appropriated a total of 9.3, but that's in addition to the govs.
Correct.
So I would say the governor appropriated this much, the
Okay.
House added this much, and then we recommend adding this much. The other thing I would like is to have this one be the very first one on the list. For me, this is the most important one.
Okay, governor's recommend is,
My little sheet kind of explains it if you want. I can help you with that.
great. 1.8 million, and I don't want to say that, now we have to.
So what are we saying here?
Jen is just cleaning up the.
Jen's cleaning up. Okay,
But
so-
I wanted this one to be listed first because this is my priority for our budget asks.
Oh, it's a total priority, I think, for all of us to make this happen. We can take that whole line and put it at the.
Yeah, and just making
Yes,
it clear that this is the committee or.
Can I make a suggestion too? I'm sorry if this creates work for Jen, but to maybe to Senator Hardy's point about the stuff that's already in the budget that you're supporting versus new initiative, it might be helpful to the appropriations committee to see what it is you're asking for above what's already in the budget. So you break it out and you can have things that, specific legislation we support. So then you don't have to list them all. You're just listing things specifically to support. And then you have another section like initiatives we also support that are not in the budget or increased. Because that would be really helpful to them, being the budget person, to know what it is you're asking above the budget.
Yes, that's true. And then there are things that are in the budget that are in bills that we're passing. So those things I think
can
we
break
need.
that
to
out into
be-
3.
Yeah,
Bills that you have, things that are in the budget that you support, and then things you're asking for that are above the budget in the House.
how hard is that to do, Jen, for you?
It's just gonna be a lot of numbers. I don't know yet.
Or we
I'm
can
working
use
on getting
different
this.
little, like an asterisk and a delta, and
I think
it's
I'm
really
trying to make it
helpful for the
simple,
budget
yeah.
people. That's why I suggested it too. It gets very confusing for a budget person to have it.
Otherwise, I'm gonna be asked to do it again.
yeah, okay, all right, well, let's go forward.
Okay, so change the note to say governor's recommendation was 6.8 million, which would be a 3% increase. House appropriated an additional 4% on top of the 3%, which would be a 7% increase. This. And that. So then that's the 6.8 plus the 9.4, Nolan, can you just?
Yeah.
All right, well, I will just come back to this. I will
I can help you with that. We don't do that in public.
Okay, then there's the adult day service rate increase request to $25 an hour.
So my thinking was that adult day is included in
It
the,
is, so this is what I went to Nolan with yesterday, and he explained.
that's not,
So this would be the amount to get them to 25, the amount above the House 7% that would be necessary to get them all the way up to $25 an hour.
Yep.
So if you take the House 7%, it's 2.5 million would be needed to,
I
on
guess,
top of that, to get the adult day providers to $25 an hour.
I'm just, is it
they get $25 an hour per client? Or is it they would get paid $25 an hour? What is the $25 an hour? Because we just put money into, a couple of years ago, get mental health workers up to, was it $11 an hour?
13.
13. I don't know what the specifics are. I mean, what, is that the amount they get reimbursed per person per hour, or is it their wages? I bet it's per person.
Right, I think it's the Medicaid
Reimbursed.
fee for service rate.
Okay, that makes more
But I
sense.
don't,
If I could also help, so the current rate is $17.44 an hour. The 10% increase gets them to $18.96 an hour. So going to 25, it's quite a leap. It's a 41%, it's a 41% increase.
Yeah, so it's over and above what we have in the 10%. So I think let's be consistent with the 10%. I'm not thinking that, I think this would begin to set things out of whack, and we don't even know whether we can reach 10% based on the available.
From what I heard yesterday,
Yeah.
it's not likely.
The adult day
Not.
part of the Coleman community base,
Yeah.
so they're already in the
Yeah.
adult, in the
So
10%,
so
okay.
I would say
Yeah,
that
let's-
we don't support.
okay, then we'll just take it
Take
out.
it out, yeah.
Yep.
Okay. And I object.
And that doesn't mean we don't love our adult days and that we want these people to
I
be
just want to be on the record, I object to it.
Huh?
I work for an adult day, so I object.
But it's included in the Vermont community base.
Yeah,
Okay.
Yeah,
yeah.
I just know they all always struggle. We really need, we haven't gotten the ones back we lost with the pandemic. Yeah, including one of our barriers are back.
Okay. Let's
That's a
go
big
to the
catch.
Resource Center for Justice Involved Vermonters. This was a separate request for folks who are coming out of corrections and need specialized recovery support. That our recommend, what do we say here? Part of the recovery.
You support it and you note that it should be considered as part of the recovery center services for people leaving DOC custody.
Yeah, I think we just leave that just the way it is. Yeah.
And was this one time or base? Was this one time or base? We were noting it on the previous page and we stopped noting it for whatever reason on page 4, so.
Well, at this point, I think it's one time.
One time.
And then, because if it gets incorporated into other recovery services, some of the recovery services are one time, some of them are not. I don't know how that's sugaring off right now.
Well, do you know if it's one time or?
What's that? I'm sorry.
The Research Center for Justice and Well Vermonters, the pilot, so I guess I suggest it would be one time.
I think I put it in one time.
And then I would say the same thing for the CIS below, Community Data System Expansion.
It does say ARPA one-time funds.
I thought we were gonna do the full, we had talked about doing the full 1.2 million.
We had, and then we decided not to based on the amount of money that's involved. So if we put everything in, what was the number?
It was 1.59, 1.59 was the all 12 regional. And then, but just to do the 4 counties was.
So the data system expansion.
The other piece is that if you do the big one, there's an annual cost of 320,000.
That's right.
But if you do the short one, they said they can eat it.
It's one time.
Then they can eat the future costs.
I'm just concerned because it's only 4 counties. None of them are our counties.
That just shows how.
Yours is already done.
Wait, that shows how egalitarian we are. That's right. Yeah. I would think, let's keep it at this level and probes can also expand it, should that?
I guess I would change it then to just say put the full amount for the proposal, their full proposal amount, and say we're recommending the smaller amount. So
Okay.
approach sees that there's
Yes,
a
good.
larger request
Okay.
that
Good.
we sort of
I like that.
compromised on.
Yeah.
I know.
So the next four are from the suicide prevention language that we looked at last week.
Right.
So there's the 988 crisis line, that's 1.35 million. The House and the governor's budget recommend 440,000. And your support is at 900,000, so.
You know, and this is one of those where we're still working on the bill, but what my question is, are we gonna send the language to appropriations along with this rather than sending it?
Yes,
out?
yep, so we're saying,
Yeah,
if you could see in the right-hand column, it says C, Senate Health and Welfare language proposal below.
Yeah.
And then Kitty's got the language.
yeah, let's do that.
We never voted on it. I'm not comfortable with this. I was not comfortable with the information or the testimony we got on this. We never voted on this bill.
We're voting on the appropriations request for the suicide hotline, program expansion, director. And so Joel and Cirillo sent us separate language after we had a separate one. We had the language from the fund about the trust fund, and then the language has changed. So we'll look at the language below and then we'll make a decision as it fits with the budget appropriations. There does need to be policy language associated with it.
Yeah, I know, but the whole thing made me, the way it all came about.
Okay,
I'm just not
I'm
comfortable
agreeing
with
with you. It wasn't a fun time. It wasn't well coordinated.
And it's a lot of money to put on here, and frankly, I'd rather fund the full CIS thing than fund some of this, because I just didn't feel like they made their case very well, and it was
I think
confusing.
suicide prevention.
Well, obviously, it's not that I'm just, but we have to make,
Senator Hardy.
we have to make decisions about, but I'm a budget person. You make decisions about budgets, and they're hard decisions.
I think there's also a typo with that statewide director for suicide prevention. I don't believe it's 125 million.
Oh, that's a good call.
Oh, thank you,
We're on the
Senator.
line.
Right behind you.
That would be a very affluent.
It's 125 million.
Okay.
Things like, the crisis line and the elder care and stuff.
I think a lot of this is in the budget.
Yeah, a lot of it is already in the budget, so it just seems.
Yes,
It was almost like this was a
but
presentation.
the bill is in our committee, so it's like the catch-22 for us.
So are you wanting to just take these out because they're in the budget?
The support is at a different.
No, because I think we want to have some language in there that's guiding this, so we'll wait till we look at the language.
They're in the budget and they're asking for more than what's in the budget.
Yes.
Do you want me to skip to the language now while you're talking about it, or keep moving?
Sure.
Okay. So your draft, the amounts are noting their asks, not your support column, so we're changing that now.
Right now while you're talking.
Yeah, so in section A, this is the appropriation for the suicide prevention lifeline. Fiscal year 23, the General Assembly shall appropriate 900,000 for your ask from the general fund to DMH for the purpose of funding an anticipated increase in the use of the state suicide prevention lifeline call centers. In section B, this is the Zero Suicide Program. In fiscal year 23, the General Assembly shall appropriate 700,000 from the general fund to DMH for the purpose of expanding Zero Suicide Program and other comprehensive suicide prevention initiatives to engage a statewide coalition with broad public and private sector representation and build coalition partner capacity to assist in suicide prevention planning, implementation, and evaluation. That includes, first, expanding Zero Suicide Program through workforce development and technical assistance to 10 designated agencies, 2 specialized service agencies, and preferred providers including expansion to primary care practices. Second, building school-based pathways to care through You Matter for Schools program. Third, offering access to ongoing gatekeeper training throughout all communities with a focus on cultural competencies. Fourth, supporting public education and information to reduce stigma associated with help seeking and to improve awareness and access to suicide prevention support and services. And lastly, supporting, coordinating, or offering any combination thereof, comprehensive suicide prevention and postvention training throughout the state. You'll notice postvention is highlighted. This is what I flagged earlier. Do you want a definition of postvention if you move forward with this language?
What is it?
Postvention are sort of after the fact of a death by suicide, the supports for persons and that, you know, that had been in that person's sort of circle, whether family or community members.
Never heard that word.
Yeah, I mean, it's not otherwise in statute, so it sort of, to me, was a term that begged to definition, but maybe feel it.
Yeah, go ahead.
Okay, Director of Suicide Prevention. This is the language that would go in the green books. The next we have the appropriation. So there is established a permanent full-time Director of Suicide Prevention within DMH to coordinate statewide suicide prevention efforts across state government and in collaboration with community partners, mental health care providers, crisis providers, and other organizations, regularly interfacing with individuals at risk of death by suicide. The director shall work with stakeholders such as Vermont Suicide Prevention Coalition to oversee the development and implementation of a comprehensive state plan for suicide prevention and promote positive youth development for lifelong mental health through school health and health education in coordination with AOA. And then this is annually directing the director to submit a written report to the committees of jurisdiction on the development and implementation of a comprehensive state plan for suicide prevention. And then the appropriation for this is fiscal year 23, the General Assembly shall appropriate 120 from the general fund to DMH for the director position. And then in section E, in fiscal year 23, the General Assembly shall appropriate 100,000 from the general fund to Dale for the purpose of expanding the elder care clinician program or the vet-to-vet visitor program or both.
So is this language not in the House budget as it is?
No, the language itself is not, but some of the money is requested in different amounts.
So just to go back up to the table, Katie, so just for example, the 988 crisis line, they asked for 1.35. Was that in the governor's budget recommend?
It looks like the governor's was 440.
Oh, so the House and the governor. And now they're saying they would need 900,000.
Well, they're asking for 135. Thank you, 1.35 million. And your language is saying you support at an amount of 900,000. So you're splitting the difference.
I see. Okay.
And the same thing for zero suicide. So I don't know what the governor's original recommend was, but the House budget at 260,000. Then the ask came at 1.2 million, and you're supporting at a level of 700,000. For the suicide prevention director, the House budget is funding it at 115. They're asking for 125, and you're supporting it. You're splitting the difference, 120.
I think it doesn't matter if you're at 115 or 125, because that's inclusive of benefits, salary. We don't know if they're gonna, what their insurance costs are gonna be. And if they want more, it could come back and budget adjustment. I don't think it matters if you're splitting the difference on that one. You can pick whatever number you want regardless.
We split the difference.
It's not a big deal, is my point. The
Okay.
costs will be unknown.
And that's in the elder care.
It looks, I don't know what the governor's recommend was, but it looks like a House budgeted at 100. They're still asking for 100, and your recommend is to support it at 100.
Okay.
All right, so this does not include all of that extra
No.
language.
So
Right,
this
so
is
that's
special.
gone.
Okay,
That's
all right, I can
That's why, and that's probably important that we did that.
Okay,
Okay,
should I keep moving?
yes, please.
Okay, so the diaper bank, the ask was for 180,000.
I think we need a working group for this.
And this committee
Yeah, you and I will be on it. Two senators.
The committee supports at the amount of 50,000 and the funds are to be appropriated. So the distribution moves through the food bank.
I think, I don't support it. I think the number is way too low.
You do?
I do. I think that when we look at what the cost of inflation, we know what gas prices are, we know that parents, especially single mothers, are having to make some tremendously tough decisions right now to support their families. I think, I really would support the 180, if not more. I think it's critically important. You know, parents, especially moms, are having to make very, very difficult decisions. And 50 is not nearly enough.
Okay,
How much did you say you would,
That's a
He wants to put the whole-
180.
the whole one.
the whole diaper?
Put it in there. We're talking about 180 and we're gonna spend $500,000 to revamp the computer system. You know, we talked about an hour ago, so this is tangible products that Vermonters need. Diapers are a real thing. Well, 50 is not nearly enough.
Well, so what does everybody think about that? Increasing the number from 50 to something? But,
I'm fine with it. I think Senator Terrence
Okay.
is a good.
Josh has
Okay.
made, the Senator Terenzini has made his argument, we'll take it.
It might, at some point, you could ask the feds to include it in food stamps.
We did. We sent them a letter.
I know, but squeaky wheels, you might start talking at NCSL about
Diapers.
diapers. And I mean, just, it's, you start talking, I mean, it used to be that say, wash your own, I mean, cloth diaper, I mean, paper diapers were a luxury. But if you're renting and you need to use some kind of a public laundry, they won't let you in there, or all the other customers will leave. I mean, it's just, things have changed. They used to be diaper washing.
Yes, yeah.
I don't think they are, you know, maybe New York City, but not general.
Okay, so we're putting in the Terenzini diaper request?
So you're supporting the 180?
Yeah.
Okay.
Good job.
So we'll just say support and then keep the funds
Good argument, Senator.
to go through the food bank.
The next is a comprehensive care clinic for HIV and AIDS, 100,000 is the request. We haven't heard testimony about this, so you're deferring to Senate
I
appropriations.
just think leave it out, because it's just, it came in late, there's not,
This one,
this is,
Okay, take it out. The next one is HIV AIDS services funding. The proposal is for 390,000. The House budget came in at 295. We haven't heard any testimony on this, so your position is to defer to Senator Probst.
the DeVega thing was my
we
daughter.
probably should leave this one,
She was
yeah.
doing general
This has happened in the past, this is funny.
Yeah, we haven't heard.
I think that if you're deferring to probes, you can just take it out.
Yeah.
Okay.
Yeah, just leave them all out.
Okay, I'm totally there.
Great. And then the last one is the Vermont Food Bank.
Yeah, unfortunately, we don't support that at this time.
6 months. Okay.
So do you want to just take that out as well? So it's not, or do you want to
I think we
specifically
can say we
say?
don't support it.
I would mention that they got $7 million in the budget adjustment, because that is one of the reasons
Yes,
why.
that's
we're
the
not
reason.
supporting, because we just gave them 7 million.
There's
Right.
one and a
That's up
half,
from zero.
there's 1.5 in the House budget.
Right, and I would support the House budget 1.5, plus they got the 7 and
But good point, so can we add that?
Yeah, this is, they didn't used to get funding.
It's just
Zero
the
to
pandemic,
6
and
million.
we had a huge amount of ARPA. We had federal funds available, we used it, and this is what's happened to a lot of organizations. and within requests, it's seen the dollars, it's stabilized people, and now,
Well, people couldn't work. Everything was shut down. Now,
Didn't Jeff Bezos' former wife just give a huge donation?
okay,
we should
Like
tell her, yeah,
millions of
she
dollars,
did.
wasn't it?
Yeah.
Yeah.
Maybe we should tell her about diapers.
maybe we should what?
Diapers. Bezos about diapers.
You have a phone number, I'll call her. Now we get older.
Okay, so here's the thing,
I'm sure.
we're gonna let Katie and Jen and Nolan do their magic on this, we're gonna hear back from Monica Hutt on the prevention coalitions, and then we'll try to finalize this, and it may be that we're talking together today about it, if we can get something, because the sooner we can get this to approach, the happier we will all be.
So I know that it's really late in the game, but we keep having requests and.
That's the list.
Okay.
They'll go to appropriations. We are not the appropriations committee. Our goal is to make sure that all of this resonates with our policy requests, and that we are prioritizing some things that are either not in the budget or that we passed in bills, or that we want to see improved.
Is that appropriations will do, or appropriations?
Yes, they will, and then we'll matter.
Anyway,
So we'll send you.
so that being said, I received a phone call yesterday, I believe you did, about the Howard Center's facility down there.
Me too.
Yes, totally for it.
Really? Okay, so what do we need to do to just suggest that?
Is that the one that Nolan added on here, or?
What is
it?
It's a residential care.
Yes, I added it, but their request wasn't a dollar amount, it was, they asked for an adjustment of funding formula.
Yes.
So there's
Right,
no
for the-
amount tied to it, it's a policy change.
Okay, well, but they are asking for money in that.
Not in the thing that I saw, there was no dollar amount, they were asking for the
ECF.
methodology change for the formula for how they're funded, but there was not a dollar.
Right.
But the request we got yesterday was for a dollar amount.
Oh, okay, I haven't seen that.
That would,
Oh, okay.
they initially had thought about asking for
Make sure you.
a base funding, and that's the thing that they really would like to do, in the methodology that does design. But they also talked about the fact that the facility in Rutland is, we're in the process of purchasing that facility, and money used, if we see our way clear to help them with purchasing costs, that would free up money for programs. And this is a program that deals with boys who have been adolescent males with behavioral problems, especially dealing with sexual behavior, and helping talk about prevention, helping them to not go down the path to become adult perpetrators, and it's also been during the pandemic a place for the juvenile or the justice involved youth that we've had such a difficult time replacing to go. So it's something that there's a way of helping them out to free up some of those funds so that they can increase their programming, and doing that by helping them to purchase the facility. They have a pretty good deal, I think, on it. It's about $1 million for the facility. They brought it down to $585,000 because there are repairs that need to be made. But that would be really helpful. And I'm not sure, what's the process for.
Is it a residential
It
facility?
is a residential facility.
I think again, this is a housing issue and that they should try in the housing budgets, that if it's a facility, that they're asking for money for the facility.
Exactly, and that was their way of getting around asking for money for the base.
Yeah, I mean, this one aligns for me with the pathways request for expansion to Bennington, because they're looking for an expansion to Bennington, but at the same time, there are pathways in Burlington and like 3 or 4 other cities and towns and cities in the state. And my concern is, why don't we have some integration of services? So for the peer respite support, and the pathways, which the substance use disorder, why don't we just have some of those things fitting together?
And it's a function of getting housing money.
Yeah, I mean, I feel like we missed the boat with, our committee should have weighed in more on the housing stuff. Because
Yeah.
there's just so much
Yes.
of housing needs in our area that I feel like we should be getting language in the budget that says that these are some things that housing should be prioritizing: developmental disabilities, this type of thing, mental health housing, and all those related facility costs.
So, and we tried to do that a little bit with 195.
And
There's such a week, I did add language in the notes under 195 about that, such as expanding or integrating. So we'll keep at it. We'll be talking to folks. Here's where we are. I think looking at 265, we only have 15 minutes, but I'd like to go through the language that Katie, you put together. And I would say this: we also received language and suggestions from the Department of Children and Family. And Erin, did you? Yes, Erin posted that language. And what I'm going to say is ask you to go through that language that's there, because their recommendations are consistent. Are you okay?
Yes, and not my non-spill leftover.
We don't have
Spill,
to.
that's all right, it's still there.
Oh, thank you. All right.
Thanks, Jen.
So the DCF language, and I guess I guess we should go through that language independently, and then I'm gonna ask Katie and maybe Ruth to look at that language along with what we have in front of us. So let's go to see what you have put together, Katie.
Sure. So we're looking at draft 1.1, and I've highlighted the changes in yellow.
Okay.
Katie McClin, Office of Legislative Counsel, for the record. I didn't say that when I sat down. Okay, so page 2. This is sort of the mission statement for what the office does, and this has been reworded a bit. And maybe I should just sort of first note that the language in the House version as it came over had language sort of was broad, that the focus was on children receiving services from the department, but it didn't, and then it said including, involvement in child protection and juvenile justice systems. And due to that broadness, that would pull in families receiving CCFAP or sort of programs unrelated to child protection, juvenile justice. So this language kind of focuses the mission a bit more and moves away from that broader language. So now this statement is that there's established the Office of the Child, Youth, and Family Advocate for the purpose of advancing the interests and welfare of Vermont's children and youths. The office shall advocate for the best interests of the children and youths receiving services from the department and those involved in the child protection and juvenile justice systems. The office shall promote reforms necessary to better serve Vermont's children, youths, and families in a manner that addresses racial and social equity. That language had been there, just moved down. And the office shall act independently of any state agency in the performance of its duties. That's still there. And then the duties of the office had been embedded in that previous section. So we pulled that out into a standalone section on duties and authority. And now this sort of models what is in the healthcare advocates language, in that some of the duties are shalls, they're mandatory requirements that the office has to do. And then there's a subsection of may, so that the office may do it, they have the authority to do it, but they're not required to do it. So you'll see some of the strikeouts just mean that items have dropped down to the may list instead of the shall list. So first, the office shall work in collaboration with relevant parties to strengthen the department's services for children, youth, and families. Subdivision 2 has dropped down to the next list. I'll review it there. And then we have review complaints concerning the actions of the department and any other entity that provides services to children, youth, and families through funds provided by the department, make appropriate referrals, investigate those complaints, or the advocate determines the child, youth, or family may be in need of assistance. What's removed there is reviewing the systemic issues and the department's provision of services. Subdivision 3 has been renumbered but not changed. I'll skip over that. Subdivision 5 has moved to the may list, and subdivisions 4 and 4 has not changed other than being renumbered. Subdivision 5 is the annual report, and what has been removed from the report is looking at the quality of services provided to children, youth, and family, because the lead-in language talks about the report addresses services. Could be seen as duplicative to list services twice. Also removed is the report was to address systemic findings, and now the word systemic has been removed, so just findings related to services. And then subdivision 8 has dropped down to the may list. So the office may, so this language all comes from the original list. The original list said analyze and monitor, now just monitor the development and implementation of federal, state, and local laws, regulations, and policies. Second, review current systems to assess versus determine to what extent children and youth are placed in custody of the department. And lastly, address any challenges in accessing information or records that are necessary for carrying out the provision of the chapter. And then we have the language about the child, youth, and family advocate. You'll see the section numbers have been updated to reflect a new section being added in the chapter. And then language about the removal of the advocate has been tightened up. So previously, or the House version says that the governor's reason for removing the advocate has to be published electronically on the website of the advocate. That has been removed. So the governor's reason no longer has to be published electronically. And now the speaker and the pro tem just have to receive notice from the governor of the advocate's removal.
Is there anything in here about, because I just thinking about the memo we got from Deputy Commissioner Radke. Is there anything in here about the credentials for the advocate? What, and I'll hold that. You can just, when we get,
We've already gotten to it. So that's subsection A of 3204.
Okay.
The office is directed by the advocate, an individual who should be qualified by reason of education, expertise, and experience, and who may have a professional degree in law, social work, public health, or related field. The advocate shall serve on a full-time basis and be exempt.
Should we say may? Should we say shall have a professional degree? May means
You may not get someone with that degree willing to work for our wages.
yes. Oh.
I don't think it's,
Huh?
I think that they're gonna hire the most qualified person.
Oh, let's say that.
I think they're going to.
Yeah.
You know, so
Let's hope so. Okay. All right.
it might be micromanaging.
Nope, just raise an issue. I'm good.
Okay. That brings us down to section 3205. This is the advisory council. We're just updating dates. If you remember, this was passed in 2021, so the dates throughout the bill have to be updated. So the first meeting would be called March 15th of 2023, keeping in mind that the office opened January 1, 2023.
Mhm.
And then I can't remember what maybe originally it was 12 meetings, and now this is authorizing 8 meetings. No changes in 3206 except to the section number. Section 3207, this is access to facilities and information. So let's see. Notwithstanding any other provision of law, the advocate and deputy advocate shall, upon request, have timely access, including the right to inspect and copy records versus any records necessary to carry out the provisions of the chapter, including relevant records produced and held by state entities and third parties. The Vermont Statistical Analysis Center was concerned that the advocate would be able to get its records as a third party. And so this language is that a third party does not include the Vermont Statistical Analysis Center. And then subsection B, if the advocate determines that doing so is in the best interest of the child or youth, the advocate may. I can't remember what the underlying language was there, but this is adding a layer of the advocate isn't just talking to a child because it would be helpful to the advocate. This is kind of asking for the advocate to make a determination, is it in the child's best interest to have this conversation? So the advocate can communicate privately and visit with a child or youth who is in the custody of the department. And upon first obtaining the consent of the child or youth's parent or guardian, communicate privately and visit with a child or youth who is not in the custody of the department.
That's good. That sentence is so important. I'm thinking about residential facilities.
And then subsection C deals with facilities, access to facilities. And the language that struck was sort of muddying the waters because then it talks about private communication with children. So subsection B deals with communication with children. Subsection C deals with access to the facilities and doesn't muddy those waters anymore. It's a little bit more cut and dry. Section 3208 hasn't changed. Section 3209, I don't think has changed. Although I'll flag
I
it
don't
for
see it
myself.
in yellow, except for numbers.
I know, I was thinking that as I went through this again, or maybe somebody else flagged it for me, I can't remember now. Then in one of the lead-in sentences, we talk about contractors, and another sentence we don't. I'll have to look at that again.
Okay.
Maybe that was a conflict of interest, I'm sorry. So no changes there. Conflict of interest, this is where it was. Okay, so 3210, if you notice, that the first sentence says child, youth, and family advocate, the advocate's employees, contractors, and members of the oversight commission shall not have a conflict. And then the next sentence on the top of page 11 doesn't include all those groups when it lists what the conflicts of interest are. So what's being added here is or a member of the oversight commission, so that the list of conflicts applies to them as well. So that was sort of an oversight. I don't think it really changes the meaning of that section very much. Section 3211, that's the Oversight Commission, no changes there, except for updating cross-references with regard to meetings. The member representing Human Services is to call the first meeting of the commission to occur by August 1 of 2022. That's just updating the date because we have that year delay. Scrolling down, okay. So section 5 is being removed. What this section did is it said just 2 of the duties on the list are going to take effect earlier than all the other duties. That's being removed now that we have this list in a shall may format. The transition, the date is just being updated by a year. Again, appropriation, the date is being updated by a year. Deleting section 8, this repeals the Joint Legislative Child Protection Oversight Committee. It will be repealed before, I think it's, I forget the date, June 1?
Isn't it June?
I think it's June 1. So it will be gone before this takes effect. So that sort of muddies the waters to leave it in, so that is being removed. And then updating the effective dates with new dates and getting rid of references to sections that are being deleted. That's it.
Terrific. The changes, I think, have helped a lot. And the question I have is also an issue that was raised when we got all that information from NCSL, which is posted on our page for today. And then the comment from DCF that maybe we should be calling this person an ombudsman or ombudsperson rather than an advocate. And there's the reasons that are suggested in the memo from Deputy Commissioner Radke. So I'm just going to raise that as you're looking through the memo to consider that title, that's all.
Yeah, I
Not
haven't had a chance-
advocating.
Yeah, I haven't had a chance to read her memo, but I will read it. And
Yeah, so if you don't, do you have time to?
Yeah, I can- I
Katie,
can work with Katie.
and I'm happy to be part of that process if it's time convenient, I'm glad to do that, but, go right ahead. Do that. Anyone else wanna dive in, look at that memo from DCF? And then make, think about any suggestions that are there that might be helpful to improving the bill. Okay,
I can look at it.
we're 45 seconds early.
I have a different.
We're finished.
Good.
This has been very good. Thank you for